Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Aisha. You seem a bit upset. May I know what is bothering you? Okay. Tell me more. I'm very sorry to hear about it, Mrs. Aisha, and I totally understand that how difficult situation would be for you. Can I offer a glass of water to you? Okay. Okay, Mrs. Aisha. I'll ask you a few questions to better understand your condition. Is it okay with you? Okay. Okay. So, Mrs. Aisha, how about your energy levels? Tell me about your energy level. How you feel most of the day? Okay. If you feel sad mostly. Okay. And how about your appetite, Mrs. Aisha? If it is decreased. Okay. Have you noticed any weight loss? Okay. Any loss of interest? Okay. And do you feel fatigued or tired all the time? Okay. Have you noticed any poor concentration or memory problem? Do you find difficult in making decisions? Do you feel hopeless and helpless? Mrs. Aisha, have you ever thought of ending your life or hurting yourself? Okay, so have you ever acted on such a thought? If you made any plan or any written last notes to close ones? Okay. Okay, Mrs. Aisha, have you noticed any change in your voice? What kind of weather do you like the most? How about your bowel habits? Okay. Okay, Ms. Aisha, I'll ask you a few personal questions to better understand if it is okay with you. Okay, Ms. Aisha, how about your periods, if they are regular? Okay, do you feel any pain? No? Okay. Okay, is there any history of previous episodes of low mood requiring medication? Any previous admission in any psychiatric hospital? What did you do to help yourself with low mood previously? I'm very sorry to know about it, Mrs. Aisha, and I appreciate that how brave you are, that you made decision to come to a clinic for treatment. I really appreciate. So, Mrs. Aisha, do you smoke? And do you drink alcohol? And do you have high blood pressure? High blood sugar? And do you have kids? Okay. How old they are? Okay. Okay, Miss Aisha, what do you do for a living? Okay. How's everything at workplace? And at home? If any close one passed away recently? Okay. Okay, Mrs. Aisha, if there is any major medical problem in your immediate family member, Is any close member of family has history of any mental problem or depression? What do you think you are suffering from? You need not to be worried, Mrs. Aisha. I'm here to help you, okay? You need not to be worried, okay? Okay, so Mrs. Aisha, what worries you most about your symptoms? Okay. Okay, Mrs. Aisha, let me reassure you that treatment options are available, okay? And I'll offer you some lifestyle modification as well, okay? And you will continue your work, okay? You need not to be worried, okay, Mrs. Aisha? Okay, so Mrs. Aisha, are you taking any medicine regularly prescribed by a doctor over the counter? And do you have any drug allergies? Okay, Mrs. Aisha, is there anything else you'd like to add? Okay. Okay, Mrs. Aisha, if you are gone under investigation so far, all right. So, Mrs. Aisha, to be on safe side, I'll order a few tests. Okay, if it is feasible for you. Okay, Mrs. Aisha. So here is a thyroid function test. Okay. So please come with a report. Okay, and next appointment. Okay. And Mrs. Aisha, what I have gathered from your symptoms is that you're having a condition, okay, what we call in a medical terminology is depression, okay, and you are suffering from mild depression, okay, and so I'll encourage you to take exercise, okay, do exercise, okay, exercise will help in relieving depression, okay, and take care of your health, diet and sleep, okay, and try to sleep 6 to 9 hours, okay, and simple problem solving strategies can be tried, okay, in which after identifying different cause of problem, okay, generate solutions, okay, and then we try out one solution agreed, okay. If it does not work, we can modify solution in next meeting, okay. Is everything clear till now? Okay, so Mrs. Aisha, I'm referring you, okay, to psychotherapist for talking therapy, okay, and that psychotherapist will brief psychological intervention, okay, and it will be very helpful for you, okay, if it makes sense to you. Yes, Miss Aisha, and you can get support from friend and family as well, okay. And I can give you address of self-help groups as well, okay. Is everything clear till now? Yes, Mrs. Aisha, so I'll not offer antidepressant pills for about 1 to 3 weeks, okay, because many at times symptoms resolve with time, okay, and meanwhile I would like you to take educational information leaflet about depression, okay, with you, okay. I hope it will be helpful for you. Is everything clear till now? And should I repeat it again for you? Okay, so Mrs. Aisha, please visit surgery after 2 weeks, okay, so that I can evaluate the development of any major depression, okay. But if you feel any change in your symptoms or feel to harm yourself, okay, and then you can contact me immediately, okay. Then I'll give you appointment, okay, and prescribe some medication, okay, along with psychotherapist treatment, okay, if it makes sense to you. Should I summarize again it for you, Mrs. Aisha? Okay, Mrs. Aisha, so you are a brave person and you will not try this again, okay, and you'll try your very best, okay, and okay, so I wish you a speedy recovery, okay. Take good care of yourself, Bye bye.